Huples Cat, April 24th, just going to do a bit of an update about how things are affecting my hospital in the Greater Toronto area in Canada. It's a major teaching hospital, Canada's biggest trauma hospital. Been a whole bunch of things happening. I just wanted to go through some things, some good things, some bad things. On the good things side, we're now splitting code blues, which patients have respiratory or cardiac or both arrests, into two ICUs, and they're both going to send one nurse each to make sure that we do able to maintain two ICU nurses to go to code blues. We're doing protected code blues now, and that means we're assuming COVID-19 when we're intubating. And we're also developing strike teams, so senior respiratory therapists, nurses and anesthesiologists are actually going to go and put the airway tubes in, not just whichever doctor or RT happens to be in the area. And that's an obvious bonus, and they're going to have proper gear because we have very limited gear. We're still experiencing incredible shortages of personal protective equipment. The good news is we are now decided that weeks into this that face shields, plastic face shields will not run out, so they're now encouraging staff to wear plastic face shields over their surgical masks as much as possible. And this will help to some degree. I'm not quite sure how that's going to affect non-clinical areas, but I think it's a good idea. Again, removing them has to be done in a certain way, and it's not as easy as just doing that, and it's going to generate a whole bunch of plastic waste. And the bad news, we're running out of hand sanitizer. Well, apparently we did get a huge donation of that recently. We were actually down to using the 125ml commercial bottles, which is obviously a problem in a hospital. And we were keeping all of our empty huge bottles for the hand dispensers and hoping we're going to refill them. So they're working on that. That was a shock. Gowns are kind of getting a little bit dodgy, so we are looking at means of extending gowns. Obviously we're using cotton gowns, which is very different from United Kingdom practice where they're using disposable level 4 gowns, but as long as they're single use I don't really have a problem with that, and as long as people know how to take them off without generating viruses in the air, that's a good thing. So that was all good news. So a lot of people are saying it's not true, there's no great calamities. Currently my hospital has gone from about near 50% occupancy to currently almost at 80% occupancy, but that doesn't tell you the actual story. The actual story is that starting in February, as we started to wind up and get ready for the surge from COVID, what we have done, and this is just a quick overview, is we have created to date 28 specific ICU beds for COVID-19 patients. That's 28 beds, ICU beds, level 1, 2, 3, that we can ventilate in. And we've created them. 10 of those beds currently are not really being used but are on standby. Of the other 18 beds, they're pretty much in use all the time. Now we're also admitting PUIs and then COVID patients into other ICUs around the hospital, so that's not the full story. But our admitted COVID patients who are positive for sure has been fairly steady at about 25 a day for the last 4 or 5 weeks. So the lockdown that we've experienced, which was very well attended and very well followed in the GTA area, is keeping a massive surge. Now this does not include anybody from long-term care, because as I mentioned before, they're not actually coming to the hospital. If they had come to the hospital we would have been overwhelmed. So we're still keeping going with very limited elective surgical cases and an almost complete focus on COVID-19. Now in terms of the floor beds, we have created 20 beds. We created 40 beds, but we've used one of those floors as an ICU because the need is ventilation, higher level of care rather than floor. And we have plans to open up another 20 beds. Again, we've opened it and closed it. The reason we opened it and closed it was because one of the others, the 2 remaining surgical floors of the 3, had an exposure from COVID disease that actually infected at least 3 or 4 members of the staff. So that's being dealt with, being monitored, being looked at, but that floor is shut down. And it's been shut down for over a week. So that's had a huge operational component. If we were in business normal, that would have been by itself very, very crippling. As again, we're not. So the occupancy rate is low in anticipation of a surge, so we can at least try to provide life support because we know a surge is probably going to come even though we're in lockdown. Our short stay surgical unit has been closed and those beds are ready to use if we need to, and we moved that into the recovery room. Our cardiac area is pretty much empty. Again, we're using that for COVID and PUI patients because they have a lot of single rooms. So we've done a huge amount of things. One of the interesting impacts was on surgical scrubs. Kitty finally got her pass and she actually now has surgical scrubs at the hospital launders. So she picks them up at the end of a shift, puts them on and takes them off at the end of the shift and disposes of them, and the hospital cleans them. So that's created a huge demand on the automatic machines and on the laundry service. So the hospital's still struggling to figure out how to do that exactly, and it is doing it and coping with it. So that's all good news. N95s remain in short supply. Thousands have been donated by the public, like thousands. And that's really, really good, but the need is massive. One of the other things is that I can't say the name of the nursing home, but one of the nursing homes close to us has suffered a massive outbreak. I believe 80 positive, and they have no staff because there's a lot of the staff are positive, and they've been appealing to my hospital for people to go there and work, and there's stuff set up to let people go there and work, and after they work there they would then have a 2-week paid quarantine period. I don't believe very many people are actually opting to do that, and I do know that the Canadian Army has been called in to help with that nursing home. As yet, the only treatment we're seeing that works is proning, where you put people face down. That takes 5 to 6 staff to do it on a ventilated patient. It's very dangerous, it's very difficult to do. It does increase oxygenation. It will remain to be seen whether that decreases mortality and morbidity. Obviously the proning people think it will. We'll see with the statistics at the end of the day. They've tried proning off and on throughout my entire career, and people swear by it and then they do some decent research and they stop doing it. So hopefully that will work in this case. What we know does work is vitamins D and C for general immunity to try and prevent people getting on the ventilator. We know that the complex ARDS that forms from COVID-19 is not really amenable just to basic ventilation. We have to use a lot of high pressure modalities and different ways of giving the air, so that's difficult. We know that we are suffering a reduction in the availability of many of the medications that we use to ventilate people. It's going to be very impossible to ventilate people if we don't have those medications, specifically paralytics and high dose sedatives. One of the things we're looking at is new paralytics, and I believe we're actually using one from anaconda snakes. So we're doing things differently. It's having a huge impact on everything we do. One of the things for me is I'm a night shift worker. I always work nights, and nights get very, very neglected in any business, and no more so in ours. What they've now done is that the massive old cafeteria that they had, and that I used to go in all the time, eventually that was closed on nights, it was closed on weekends. It's open for like an hour or two during the day, Monday through Friday, for the day people to go and have lunch in there. They're opening it up 24/7. And the specific reason they're doing that is because it's a huge space and it's fixed tables. It wouldn't really work very well as an overload space. But in terms of staff to go there and sleep, it's a great idea. A lot of the nurses are sleeping in their cars at night, and that's great, but the security issue is definitely a problem with that. So people are doing and adapting and doing whatever they can to try and make this work well. And we are still very much hopeful that we will avoid a massive surge in Toronto. Many of us, and it's not just me, I talk to a lot of the managers and the MDs, believe that we will experience a surge at some point. It's just a question of when. We have to let lockdown go at some point, and when we do let it go, we do not expect it to have disappeared. We expect it to come back within a few weeks. So it's going to be a very trying time. Now, vaccines are being developed and they've started human trials in the United Kingdom. I'm very wary of fast-track vaccines. I'm not going to take one unless I know for a fact that it's been treated en masse and has no obvious side effects, because I'm very wary of taking new vaccines that have not been human trialed. Just because they work in primates in the lab and in vitro does not necessarily mean it will work in the human body as predicted. But if we have a stable vaccine that works well without major side effects, I will absolutely be taking it, and that will be the cure, the end point to COVID-19. If we allow everybody to get COVID-19 in the community, we're going to lose about 1% of the population. Half of that number will be under the age of 50 and without comorbidities. That's a colossal number of people. That is us losing about 400,000 people in Canada. That's a large number of people. So this is why the lockdown's in place, this is why everybody's focusing on it. And it doesn't help to have magical thinking. Magical thinking is like in World War I and in World War II to some degree, it'll be over by Christmas. Well, it was not over by Christmas, and it got a lot worse before finally ending. And that's going to happen in this pandemic. People are looking for the anti-malaria drug, they're looking for ultraviolet lights, they're looking for Lysol injections or bathing in bleach. People are looking for magical masks. People are trying to find a magical cure-all. There isn't one. There is not a magic cure. If we find one, my hospital, because of the nature of my hospital being a massive university teaching hospital, fairly well renowned in the world, will definitively be trialling this stuff, and I will bring the information to you as and when I hear it. Not the results, but the fact that we're using it. All we're trialling is a few generic things right now, like we're trialing the HIV medications, but none of us are clinically, very early on with low caseload, seeing it do anything. The patients who are sick with COVID-19 are extremely sick, and it's not just old people and it's not just people with disabilities. It's a lottery. If you catch it, you don't want to, but if you catch it, you don't want to pass it on to other people. And if you catch it and you get sick, you might need hospitalization. And if you need hospitalization, you might need a ventilator. And if you need a ventilator, you've got about a 70 to 80% chance of dying. Okay? Now, a lot of people die before they reach the ventilator. This is a very dramatic disease, especially in the healthy people. They will look healthy, they will be fine, they're compromised, but they're okay, and they'll go to the washroom and they'll die in the washroom. It's stunning. It's stunning how fast people collapse with COVID-19. It's very atypical pneumonia. It's not the traditional da-da-da-da-da. People who get sick with this are really, really ill, very debilitated for days to weeks. So it's not a joke, it's not a hoax, it's not something that we can wish away with magical thinking. Now we're also getting to jump the lines in grocery stores and other places up here. I'm not really going to jump the line unless I need to, because I'm after nights or something, in which case I will. Because, you know, when you've worked a 13, 14 hour night shift, you don't want to line up for half an hour to get in a grocery store to grab some food. But if I'm off, I'm not going to use my tag to get in stores, and I would appeal to frontline workers who are getting benefits. Only use those benefits if you need it.
Excuse the noise, but I just want to do a real quick thank you video. A lot of people have been, doing thanks for nurses, doctors, firefighters, first responders, and stuff like that. But I just want to say a quick thank you to all of the businesses that have been supporting the first responders. Right now I'm in a car wash, getting my car washed for free. Place that's called Crew Car Wash. They are giving first responders for this whole month free car washes, just as a thank you. I appreciate that. The gas companies and light companies, they're not disconnecting people if you can't pay your bills right now. I appreciate that. People are being nice right now, and I hope it's something that can continue as we go forward outside of this pandemic. So, thank you.
Hashman Hills had a free car wash, and I'm sure at his probable income level that was great for him. But for example, if we got offered a free car wash for me and Kitty whilst we're both working, I wouldn't take it up. I would pay for the car wash if I wanted one, because I can. So bear that in mind. A lot of the nurses, a lot of the doctors are actually fortunate to be getting quite large incomes right now because of the overtime. Kitty made a stunning amount of money last time around because she had to do 2.5 12-hour shifts on overtime. And we're trying not to do overtime for obvious reasons, but we're the fortunate ones, okay? We're going out to work, we're meeting different people and talking to them. Yesterday we were out walking the dog and the dogs, the neighbours, the good neighbours. The wife's really nice, but she's obviously very shy. She actually came rushing down the driveway and stopped, obviously, to talk to us. Even though she's a very introverted personality. We know her, she's a very nice person, but she's a very introverted personality. You could tell the hunger that she had to actually talk to somebody, because she works for a bank and she's been trapped at home for weeks now doing online stuff, which she hates. And it's interesting, you see a definitive psychological change in the population who are actually in lockdown compared to those of us who are fortunate enough to actually not be locked down as tightly. Now, we're risking a lot of things by not being locked down, but you know, at the end of the day, really work your social networks electronically and reach out to people you might not necessarily reach out to. Generally speaking, it's really important people are actually in communication. So that's about all for me. Just wanted to point out to you that this is still going on. It hasn't disappeared. Our numbers are stable in terms of positive patients, but daily, weekly, the numbers are creeping slightly up, ever up in terms of ICU capacity. So we're reaching the point where we're having to do things very, very much differently in terms of staffing and workload, and it's an enormous strain on everybody involved. And I never thought I'd see the day where we have buckets around to recycle masks in and buckets around to recycle hand sanitizer containers in. It's that dire. Supplies are that much in demand across the planet. So each of us needs to be very conscious of not wasting equipment at work, and nothing is single use unless it has to be, and really do your best to try and make sure that a week from now, that mask you just threw on for no reason and then threw away, that mask is going to be there for somebody who needs it in a dire situation. So take care. Let me know how people are doing. I'm really interested. I am getting some more masks. I believe N95s that will fit Kitty, and I'm really happy about that. And obviously if we have too much, we're going to actually start distributing the N95s to people at work as well. But the other thing is that Janine McQueen sent me a whole bunch of masks, and I'm really happy, Janine. And I've been a little slow on sending you the pictures because I actually want to put the pictures together because we were able to give them to way more people. But they're a little slow on taking the selfies. But I will put one or two up, and I will do a proper thank you video. It's been very important, those cloth masks, to my co-workers and my family and me, to be able to feel that we're protected from infecting other people and from getting the infection when we go shopping or when we're in close communication with people. So let me know what's going on around your neck of the woods. That's just what's happening in Toronto and Canada, in the GDA area. Parks are still shut down, the lockdown is still fully in effect. Restaurants and bars are still closed, swimming pools are still closed. You can't use park equipment, or you can't use playing fields. If you do, you're liable for a 750 Canadian fine. And most people aren't walking as much as they could in areas that are fortunate like mine where you can. They still haven't closed road traffic in the downtown core. They absolutely need to do that so those poor people in the condominiums can get out safely. Like right now, if I had to walk and I was in one of those condominiums, I'd have to wear an N95. It's that congested. But people just aren't going out. People are very much following the stay-at-home suggestions that our governments have put in place, and they're being very, very good about it. One of the things I've noticed is blue ribbons around a lot of the trees in my area. I'm guessing it's for nursing, frontline, doctors, everybody, heroes. And I think that's really nice, but I'd really like an adequate supply of N95. I think we're a smart species. I think it's time, before we hit May, that our various governments around the world actually get manufacturers to produce enough N95 so we can have them whenever we need them. And that would be a really important psychological turning point for me and Kitty. The other one is being tested. Kitty was not exposed to a worker on her ICU that was infected, so she's not being tested. She's asymptomatic, so she's not being tested. So she could potentially be tested if she wanted to be, as could I at this point. We're not going to do so because we're still protecting ourselves and protecting others from any possibility of transfer. There is no treatment, and we don't necessarily want to go and waste testing facilities on people who actually have symptoms. The other issue is the testing facilities put the person being tested at huge risk. This is why a lot of them are outdoors, because obviously that's a lot safer. But having testing facilities indoors like ours, I don't really want to be in a room that's had a whole bunch of people trundling through it who may or may not have COVID-19. So that's it from me. Remember, in SHTF, tomorrow will always be worse than today. And in a pandemic, tomorrow is definitely worse than today until we hit the peak. When we hit the peak, we'll lose as many on the way down as we did on the way up. This is the most significant event in our lifetime. Please take it seriously. Please don't get caught up in politics. It doesn't matter who is the President of the United States. It doesn't matter who's the Premier of Ontario. It doesn't matter who's the Prime Minister of Canada or England. What matters is that they listen to the best available scientific medical advice without magical thinking. That will get us through this. Supporting each other on a personal level, helping your neighbours out where you can. That's what's needed, and it might be needed for months. I won't lie, this could easily be 18 months to 28 months. It could be. Historically, it probably will be. Remains to be seen. Nobody knows. Toodles.
You haven't got beer.
Mr. Bear.
Mr. Bear!
Mr. Bear.
Mr. Bear's nose.
Are we all ready for a big group? Meow.